So good afternoon. When I was in second grade, my teacher said to me one day, Alma, when you grow up, I think you should be a doctor. How did she know to say that? I have no idea. Although, as I have progressed in my career, I look back on that moment in time. And what I'd like to share with you in the next few minutes is what I feel are those qualities that she saw, that each one of you obviously also have when it comes to being a leader. I'm Alma Littles, and I also am a family physician. So I won't even date when I attended this school. Although I will tell you that I was here for the first one. When this conference was formed. And, having already served on the Minority Affairs Committee for the AAFP, which was one of the precursor groups to this meeting, there was that something that was there in terms of the leadership. But what I got from this conference and from previous meetings that I had attended was that it's important to affiliate with people who are in positions that you might aspire to be to, even if you don't recognize at the time that it's an aspiration of yours. So one of the benefits of this meeting is that you get to meet people from all over the country, actually all over the world, because we have international members attending this meeting as well. And you get to learn about what they're doing and what inspires them and what motivates them. And then you can take on some of those same skills. It gives you that network of individuals that you can call on at any given time. So, I've got pictures here. Some of you may recognize some of the folks in the pictures up there. And they weren't here, by the way, at the first meeting of NCCL and its precursor groups. But, surgeon generals, secretaries of HHS, presidents of universities, deans of medical schools, those individuals will be at the various meetings you attend. And I encourage you, particularly the new attendees, to get to know who they are and talk to them about their experiences. And you'll find, just like your young medical students and young residents, that many others have done it before you, and you too can do that. And others will recognize those qualities in you. So talking about what some of those traits are, and some of them you've actually already heard. You show up and you get involved. As we said earlier, you volunteer, you say yes when it's something that you actually can do and that you actually can contribute to. And you participate, you prepare, you participate, you read the minutes, you ask questions in the meetings that you're attending, and you learn as much as you can about the organization so that you are informed and can ask those questions. And don't let opportunities pass you by. If you have the opportunity to be involved in something, if you have the opportunity to get added certificates, in particularly in leadership areas, go for it. You never know when it will come in handy for you to use later, and I'll talk some about that. And the other is when you acquire those credentials, don't let them lapse unless you absolutely have to, because you may be called on to use them again. So even if you leave, the direct patient care, part of what you do, maintain your license, maintain your board certification, because you never know when it will come in handy again for other things. Oops, here we go. So from my perspective, leadership for all of us starts long before we actually come to this meeting. And again, whether you recognize it or not, you're already leaders, and these meetings are really to hone those skills in, starting out, actually even before college, but, college, medical school, residents. I suspect many of you were probably chief residents as well, leaders of your practice. I also had a solo practice when I initially finished residency, and then went on to join the faculty of the residency program, became director of that program, when the FSU College of Medicine came on board as the first new medical school in this country in over 25 years in 2000, and I was called on. You know, I had acquired several certifications that prepared me to be able to say yes when that door opened. And that's really the message I'd like to leave with you, is to be prepared to say yes when opportunities come your way, recognize that you may not always know when they're there. So what Callie asked me to speak on, really, she wanted me to focus on some of the things that I'm doing now, but it was hard to start there because everything that came before that really helped to prepare me for the many positions that I have right now that allow me to then help others and allow me to mentor others coming behind me. So a couple of the ones that I was going to focus on, that she asked me to focus on, was serving on the advisory board for the Robert Graham Center. Now, when Bob Phillips called me back in the early 2000s to ask me to do that, you know, I was like, you know, why? What skill could I possibly have that you would want on that board? And what he was looking for was someone who had experience in practicing in a rural area, and someone who had experience in academic medicine as well. And it's like, so I had done both of those things. So I was like, okay, sure, I'll give it a try. I can tell you that I've learned much more by serving on that board, I think, than I could have ever provided in that skill set. But again, it's picking that right time to say yes when you're approached and being ready to go through that door. The other is, this year I've served as chair of the academic physician section of the American Medical Association. And again, my daytime job at the medical school actually really helped to prepare me for that. But a lot of those specific direct, you know, leadership skills really started in meetings just like this that allowed me to continue in there. So I want to end by talking about mentorship because I think that's very, very important. First, you know, find a mentor. These meetings are great places to look for mentors if you don't already have them. You know, find a mentor, someone you can bounce things off of, and they don't have to be where you are, because in particular with social media and all the other connections, how you can connect with them anywhere they are. But find a mentor who can help you figure out when to say yes and to say no as your career progresses. The people in the room who know me know that I haven't found a mentor to help me say no yet, but I'm still working on that piece. But find someone that you can bounce things off of. And then the other is be a mentor. You know, always look to bring someone else behind you and help guide and train others toward their goals and success with that. So the pictures here again, one of my mentors who was residency director when I started residency, and then the mentees, so to speak, the one on the left are some of our students at a poster symposium, and the one in the middle is actually one of our medical students who was a former football player at FSU who's now in medical school doing quite well, former Rhodes Scholar, who sought me out for that, and I'm very proud of him. And then finally, don't forget your support system. You know, those who really do keep you grounded. There's a picture of my husband and I in those brief moments of time that we had to have fun. And my son and I are Florida State football games. And you can see the difference of opinion. Outfits being worn there. But, you know, find time to have fun. The message here is really, in addition to everything else that you're doing, you know, find time to stay connected to the things that got you where you are. Stay connected to family, stay connected to friends, and find ways to have fun. So that's, yeah.